her PhD and was months away from marrying the love of her life. Suddenly she fell ill, experiencing symptoms that often left her bedbound and in excruciating pain.
Yeah, Jennifer was diagnosed with chronic fatigue syndrome, or ME. Now, frustrated by a lack of understanding amongst the doctors she saw, Jennifer decided to film herself and other people with the condition for a documentary she called Unrest.
I don't think I can get up off the couch. I feel like my brain is misfiring. Sometimes I wouldn't be able to speak.
Wow.
If you say too little, they can't help you. And if you say too much, they think you're a mental patient.
The doctor would tell me, "You're just dehydrated." Everyone gets stressed. And I went online and found thousands of other people just like me.
Yeah, I'm completely bedridden.
It's like I'm just watching my life disappear.
I have ME, CFS, that's chronic fatigue syndrome.
Historically, you can see illnesses very similar to this called many different things.
It's gonna pass.
Chronic fatigue syndrome. Yeah, I'm tired too.
Well, we're joined now by filmmaker Jennifer Brea and also by Dr. Charles Shepherd, who's a medical advisor to the ME Association and contributed to the film. Thank you both for joining us this morning.
Thank you for having us.
Jennifer, you look amazing, it's fair to say. Yeah, how are you actually feeling at the moment? Because seeing that footage, it's really shocking. How are you?
Yeah, it's still really up and down. I'm really lucky to no longer be bedridden or homebound, but I still have days when I can be really stuck in bed. But I've gotten better with treatment over time.
And you're sitting like that because it's comfortable?
Yeah, so a lot of people with ME have something called POTS, which is a condition where your blood basically pools in your feet. So I have to stay here to keep the blood flowing up to my brain.
Ah, okay. I'm glad you explained it. You've been involved with the making of this film. Why was it so necessary to document?
Well, I think the film in particular is so important because it's raising awareness, one, of the condition. I mean, an awful lot of people, I'm sure you've heard of ME, CFS, but like probably the rest of the population, you're not quite sure what it is. And I think the most important part of this particular film is that it's raising awareness, not just amongst the public, but also amongst the medical profession, that severe ME exists, that 25% of people with this illness have a form which keeps them housebound, bedbound, and at the bedbound end there are people even being tube-fed, and these people are severely neglected, they're isolated, and they're not in touch with the medical profession. They've just lost touch with doctors. We're not managing this illness in that group effectively at all.
And Jennifer, you met a lot of people, didn't you, while you were making this? And what I thought was interesting was the fact that when you got ill to begin with, you started filming it, didn't you? Why did you do that? Was that just for your own reasons, or did you want to make something out of it in the end?
Yeah, I mean, I think at the beginning it was because I didn't know what I had. It takes a very long time, as Dr. Shepherd said, to get diagnosed frequently. And when I was going in to see a doctor, it was because I was feeling particularly well, because I was well enough to go in. And so, I think there's a lot of disbelief about this illness, a lot of misunderstanding, and a lot of poor treatment. The most common treatment for this disease is something called graded exercise, which can actually make many patients worse. And so I thought it was really important for medics and for the public to really bring people into the experience of what it is to live, in our homes and bedrooms.
Isn't part of the problem that this is so difficult to diagnose? I mean, and you cover this in your films, or like looking at the history of medicine in terms of how people who have had chronic fatigue symptoms, or ME, however it's been interpreted, and a lot of people dismiss it as, oh yeah, you feel tired, I get tired too.
I think we've got to dismiss this idea that this is tired all the time. It's not tired all the time. It is actually quite easy to diagnose in the vast majority of cases. Most people will present with being fit young adults. It's normally 20s, 30s, 40s, but it does affect children, teenagers as well. They will say, I was fit, well, I got an infection, I didn't recover from it. I kept on feeling unwell, flu-like, really grotty, and I had these very characteristic muscle and brain symptoms, exercise-induced muscle fatigue, pain in the muscles, problems with brain function. Jen's told us about POTS. This is the autonomic nervous system not functioning properly, feeling faint, not being able to stand up properly, problems with balance, coordination, and cognition, not being able to have sort of normal functioning memory and concentration. And that complex of symptoms following a viral infection in someone who's been previously well should be alerting a doctor to making this diagnosis.
I mean, I think the film Unrest, Jennifer, really shows that really clearly. I think we could talk a lot longer about this, but if people want to find out more about it, Jennifer's film is called Unrest, and it's available to stream online from next week.
Yeah, that's
Thank
it.
you.
Yeah, thank you so much. That's it from us. Have a good day.
Bye-bye.